So when a patient is diagnosed with end-stage renal disease and requires some form of renal replacement or kidney replacement therapy, there are basically three options. Transplant, which is getting your lifestyle very much back into what you were before, but having to take medications to prevent rejection of the kidney. And then there's in-center hemodialysis, in which the patient would come 3 times a week. We have to place a fistula in their arm so that we can clean out their blood through a filter. It takes about 3 to 4 hours each time, 3 times a week. The nice thing about that is the patient shows up and the treatment is taken care of for them. There are 2 major types of home dialysis techniques. The first is peritoneal dialysis, in which we don't deal with the blood at all, but rather deal with the peritoneal cavity, your abdominal cavity, that acts as a lining so that we can filter waste out. So what we do is we have a surgeon place a catheter in your abdomen, and then a cycler at night would filter fluid or would drain fluid into your abdomen, let it dwell there, and then drain it out. While that's occurring, you remove all your waste through your peritoneal membrane, and you can remove fluid as well. That's a technique in which you have to do every day. But the nice thing is it's done at night, it's done on cycler while you're sleeping, and you only have to see the physicians and the nursing staff once a month. Home hemodialysis is similar to in-center hemodialysis, in which we're cleaning out the blood through a filter. But the techniques or the instrumentation is less technical, so that the patient and their significant other can learn how to do it at home. You would do that 3 times a week as well, at your leisure, about 4 hours each time. That again works through the blood, so you need a fistula to have that done, but that's taught through the nursing staff at the dialysis facility. That's a nice technique because it frees you up. Again, you only have to see the staff once a month for a clinic visit, but they're always available to you, both for peritoneal dialysis, in hemodialysis. The staff is available after hours if there's any kind of problems, any troubleshooting that needs to be done. We certainly have a lot of patients on all those modalities, and they do quite well.